One of the commonest questions I get asked in clinic is, how do I maintain a healthy heart? So I normally give 3 pieces of advice. The first is to try and keep on top of the amount of alcohol you drink. Alcohol is high in calories, so if you are trying to maintain a healthy weight, cutting back on the amount of alcohol you drink can make a big difference. We also know that a high alcohol intake is associated with certain heart conditions such as atrial fibrillation and certain types of heart failure. There used to be a belief that a small amount of alcohol was actually protective for the heart. That information is a little bit out of date, but what hasn't changed is the information that too much alcohol is bad for the heart. My second piece of advice is to try to maintain a healthy weight. Being overweight or obese increases your risk of developing high blood pressure and type 2 diabetes, and both of those are bad for the heart. What is a healthy weight? Well, we use the body mass index as a way of judging this. This is calculated using your height and your weight. There are lots of online calculators which can help you calculate this, and the number you're targeting is between 20 and 25. Anything above 25 is overweight, anything above 30 is considered to be obese. How do you lose weight? Well, there are lots of different diets recommended out there. I'm not going to be a proponent of any one of those in particular, but what I would recommend is to try to eat lots of the good stuff, and that usually helps, and that means lots of fruits and vegetables. So we say 5 portions a day, and we know that eating lots of fruit and veg is actually good for your blood pressure as well. The third piece of advice is to do some exercise. We would normally say do 30 minutes 5 times a week of moderate exercise. What is moderate exercise? That might include going for a brisk walk. If you do slightly more intense exercise, such as running or cycling at pace, we would say 75 minutes across the space of a week is usually enough to get some benefit for your cardiovascular system. Again, that's easier said than done, and fitting that into a busy lifestyle if you have little children or a busy job can be very difficult. My tip is to try and build it into your commute if you commute to work, so that might mean getting off a stop earlier on the tube. I did say 3 pieces of advice. There is a 4th piece of advice which I don't really include because hopefully it should be obvious to everyone, and that is to not smoke. Smoking is associated with cancer, but it's also associated with heart disease and stroke. So those are my pieces of advice for trying to maintain a healthy heart.